Welcome back to your learning video. We are going to be demonstrating how to administer eye drops to Mr. Wilson. For the purposes of this video, you can be assured that we have already completed our medication checks when we obtained the medication from the med cart. So we've already done our checks on the medicine and the MAR. So we're bringing them into the room prepared. So let's say hello to Harry. Good morning, Harry.
Good morning.
Just to remind you, my name's Heidi. I'm your nurse. We worked together yesterday. Your bed's coming up. I'm not very good at these beds, Harry. Just give me a second here.
There you go.
There we go. Harry, can you tell me your last name one more time, please?
Harry Wilson.
Perfect. And can you recall your birthday?
September 22nd, 1942.
Excellent. Thank you so much. So, you know we're going to be giving you your eye drops again, right?
Yes.
Do you have any questions about them?
No, I've taken them for a while.
Okay, perfect. So let me just get started here. Okay. All right. So I've checked the MAR against his ID band, so I'm very certain that I'm administering this to the right patient. Okay. So we have the supplies that we need here for administering the eye drops. So I've cleaned my hands, and I'm going to let Lori narrate from here
on in. Okay, so Heidi's going to start by cleaning the eyelid and eyelashes. So she's just getting her sterile 2x2s ready. So she'll have a couple of those open, and she's going to saturate those with some sterile saline. So once she's done that, she's going to get her clean gloves on. And we're only administering this to one eye, so this is Harry's left eye. So she'll just need to clean the one eye that she is administering the medication to. And she's going to clean with that sterile 2x2, cleaning
Harry, I'll just get you to turn your head to the right there. Thanks.
Wiping from the inner canthus to the outer canthus. The purpose for this is if there's material on the eyelid or eyelashes that isn't removed, then it can be washed into the eye.
Okay.
Okay. So next we're going to administer the eye medication. That's the next step.
Okay, so I'm just going to put this on the pillow for now. So we're going to need that after we've put the drops in.
Okay, so Heidi's going to ask Harry to look up. The purpose of this is it's harder for the person to blink, or less likely they'll blink if they're looking up. So while the client looks up, Heidi's going to use her one hand to expose the lower conjunctival sac. And that'll usually be your non-dominant hand, and then you're going to use your dominant hand to administer the medication. So you can place your hand on the client's forehead, so that stabilizes your hand. It's helpful if you approach the eye from the side, because the client will be less likely to blink. And then she's going to hold the dropper about 1 to 2 centimeters actually above the conjunctival sac, being careful not to touch it, and then administer the correct number of drops.
And Harry's getting
Two drops. Yep. Okay, so you can instruct the client to close the eyelids, but don't squeeze them shut, because closing the eyes spreads the medication over the whole eyeball, but squeezing them can actually push out the medication. So what we want to do now, and what Heidi is doing, is she's using another sterile 2x2 to firmly press on the nasolacrimal duct for at least 30 seconds. And the purpose of doing this is so that it prevents medication from running out of the eye and down the duct, which would result in systemic absorption of the medication into the body.
Okay, Harry, I'm going to take the cloth off now.
Great. And once Heidi's finished that, she can remove her gloves and throw those in the garbage before she's touching. And then as soon as she's done that, she can sign her medication administration record and
Alright.
perform hand hygiene.
Thanks, Harry.
Make sure her client is left in a safe position with the bed in the lowest position, and
Alright, putting you back down here, Harry.
and the call bell.
And you've got your call bell in your left hand there.
There'll be a slightly different procedure if you're giving ointment or into the eye, which is a little bit thicker. You can find those variations in your skills textbook.